How do you inflate the cuff for auscultatory blood pressure? Have you ever wondered how to properly inflate a cuff for measuring blood pressure? This process is essential for accurate readings, especially when assessing hypertension. Let's break it down step by step. First, you need to locate the pulse on the arm where you will measure blood pressure. You can do this by feeling for the radial or brachial artery. Once you find the pulse, you are ready to inflate the cuff. Begin inflating the cuff at a moderate pace until you no longer feel the pulse. This point gives you an estimate of the systolic blood pressure. Systolic blood pressure is the pressure in your arteries when your heart beats. Now, here's an important step. After the pulse disappears, inflate the cuff an additional 30 millimeters of mercury above this estimated systolic pressure. This ensures that the cuff pressure is high enough to accurately measure blood pressure and helps avoid errors that can occur due to an auscultatory gap. An auscultatory gap is a silent interval in the sounds you hear while measuring blood pressure. Once you reach this maximum inflation pressure, which is the pulse disappearance plus 30 millimeters of mercury, it is time to deflate the cuff. Deflate it slowly and steadily at a rate of about 2 to 3 millimeters of mercury per second. While you are deflating, place a stethoscope over the brachial artery in the antecubital fossa. Listen carefully for Korotkoff sounds. The first clear tapping sound you hear indicates the systolic blood pressure. The pressure at which these sounds disappear marks the diastolic blood pressure. Diastolic blood pressure is the pressure in your arteries when your heart rests between beats. This careful method of inflating and deflating the cuff is vital for managing hypertension. Accurate blood pressure readings guide diagnosis and treatment decisions. Overinflating can cause discomfort, while underinflating risks missing true systolic pressure, especially in patients with stiff arteries or those on blood pressure medications. To summarize, inflate the cuff until the pulse disappears, then add 30 millimeters of mercury, and deflate slowly while listening for sounds. This technique ensures precise blood pressure assessment, which is essential for effective hypertension evaluation and management.